Welcome to the 2021 Medicare Advantage Plan Open Enrollment Decision Guide presentation. Open enrollment for the City of Houston Medicare Advantage Plans is from November 18th through December 11th, 2020. During this presentation, we will go over important news for 2021, including changes for the plan year and what you'll need to do by December 11th. What's the important news for 2021? The City of Houston is excited to announce our transition to Aetna Basic PPO, Aetna Premier ESA PPO, and KelseyCare Advantage HMO for our Medicare plans effective January 1st, 2021. The United Healthcare, WellCare Texan Plus, and Cigna Health Spring plans will not be offered in 2021. While we appreciate the service that they have provided to our members, we were required to enter into a competitive bid, and that yielded a $27 million savings. This is an active enrollment. You must make an election for your 2021 plan. You must submit your MA plan enrollment application no later than December 11th, 2020 to enroll in a plan. If you do not select a plan, you will be auto-enrolled in the plan that is more closely matched to your current benefits. The selected vendors are Aetna and KelseyCare Advantage. These vendors have received Medicare's highest star ratings and will provide enhanced healthcare provider coverage, lower premium rates, and transition planning to ensure your healthcare treatment will continue without any service gaps or delays. As a retiree, you are eligible for coverage if you are covered by Medicare Parts A and B. You are covered by a City of Houston health plan. You were covered by a City of Houston health plan on January 1st, 2010 and filed paperwork to opt out of a city plan. To access the Medicare Advantage enrollment form, visit cityofhoustonbenefits.org and go to the Forms and Documents tab to download a fillable PDF. During the Medicare Advantage Plan open enrollment period, forms must be submitted on or before December 11th, 2020 for a January 1st, 2021 effective date. Once you have completed your form, there are 3 ways to submit it. You can mail it to the City of Houston Benefits Division. You can upload it to the Secure Document Submission portal at cityofhoustonbenefits.org. Or you can drop it off in person to either 611 Walker Street Level Lobby or the EB Cape Center Lobby area. You have 3 plans to choose from: the Aetna Basic PPO, the Aetna Premier Extended Service Area PPO, and the KelseyCare Advantage HMO. Contributions for these plans are $18 per person per month for the Aetna Basic PPO, $63 per person per month for the Aetna Premier ESA PPO, and $42 per person per month for the KelseyCare Advantage HMO. All members will receive new ID cards. Plan participants can expect new ID cards to be mailed to their home address starting in mid to late December. Not sure which plan to select? Schedule your telephonic appointment with an Aetna Healthcare or KelseyCare Advantage representative to determine which plan is right for you. Call Aetna Healthcare at 1-800-307-4830 or KelseyCare Advantage at 713-442-2264. There are also a limited amount of in-person appointments with City of Houston Benefits Division members available. You must register for in-person appointments at cityofhoustonbenefits.org. These appointments will be at EB Cape Center at 4501 Leland Street, Houston, Texas 77023. Each plan has unique features and benefits. Over the next few slides, we will discuss the Aetna plans. At Aetna, we want things to be easy for our members. With both Aetna plans, members will have medical and pharmacy benefits combined in one plan. There is no need for a standalone Part D plan. One plan also means one ID card for all your medical and pharmacy needs, one phone number to call for questions, and one monthly explanation of benefits. Members on the Aetna plans will receive more benefits than original Medicare, and they'll have access to our care advocacy and wellness benefits. To be eligible, you have to be enrolled in Parts A and B and pay your Part B premium. You can only be enrolled in one Medicare Advantage plan at a time. With our Aetna PPO plans, you have the freedom to see any licensed doctor or hospital as long as they are eligible to receive Medicare payment and accept your plan. Again, Aetna Medicare Advantage provides coverage nationwide. No referrals are needed for our plans, and you have access to in- and out-of-network providers. Our plans also cover you when you are traveling outside the country in case you have an urgent need for medical care. When traveling away from home, Aetna will find you a doctor that accepts the Aetna Medicare Advantage plan. We encourage everyone to select a primary care physician, but this is not required. We know the most important thing for our members when reviewing health plan options is, will my doctor take this plan? Let's review your freedom of access with this plan. Both Aetna plans are national PPO plans. These plans are designed to give you the flexibility to see any provider whether or not they are in our network. You should know that many doctors do in fact accept Medicare and accept Aetna Medicare Advantage, but there are some that don't. You can use out-of-network providers, but they must be eligible to receive Medicare payment and accept your plan. If your providers say they do not accept the Aetna Medicare Advantage plan, we can call them to explain the plan and make sure their staff understands how it works. Many times, this results in the doctor's office understanding how to work with Aetna Medicare Advantage. One of the key differences between our two plans is the ESA. ESA stands for Extended Service Area. On our basic PPO plan, your copays or cost share may be higher if your doctor is out of network. On the Premier ESA PPO plan with the Extended Service Area, you can see providers in and out of network at the same cost share or copay. This is a unique feature of the Premier ESA PPO plan. Let's take a look at the plan benefits. Here you'll see a side-by-side comparison of both plans. The basic PPO has a $0 deductible and $3,400 maximum out-of-pocket for in-network medical care and a $5,000 combined maximum out-of-pocket for in- and out-of-network medical care. Preventive care is covered at 100%. PCP visits are a $0 copay, and specialists are a flat $15 copay for in-network providers and 30% for out-of-network providers. PCP visits are a $0 copay, and specialists are a flat $15 copay for in-network providers and 30% coinsurance for out-of-network providers. Inpatient hospital care is a flat $300 copay per stay, and outpatient surgery is a $150 copay when using the in-network providers and 30% coinsurance for out-of-network providers. ER visits are a $50 copay, in and out of network. Most out-of-network services will have a 30% coinsurance. The Premier ESA PPO plan has a $150 deductible and $3,500 maximum out-of-pocket for medical care. PCP and specialist visits are a $20 copay. Inpatient hospital care is a flat $250 copay per stay, and outpatient surgery is a $0 copay. ER visits have an $80 copay. The Premier plan has an extended service area, so the same cost share or copay will apply whether you are using in or out-of-network providers. Let's discuss your prescription drug benefits. Both the basic and Premier plans include Part D drug coverage. You do not need a separate Part D plan. Both plans have a preferred network. Members will have access to Aetna's entire network of pharmacies, but if you fill a prescription at a preferred pharmacy, you may pay less. Some of our preferred pharmacies in the Houston area include CVS, H-E-B, Costco, Kroger, and Walmart. The basic plan has a $0 deductible. Preferred generics will cost $15 or $10. Non-preferred generics will cost $20 or $15. Preferred brand drugs will cost $35 or $30. Non-preferred drugs will cost $50 or $45. Specialty drugs will cost $80 or $75. We also offer mail order drugs up to a 90-day supply. The Premier plan has a $0 deductible. Preferred generics will cost $5 or $2. Non-preferred generics will cost $20 or $10. Preferred brand drugs will cost $40. Non-preferred drugs will cost $75, and specialty drugs will cost $75. The Premier plan offers a discount on mail order drugs. You will pay 2 months copay for a 3-month or 90-day supply. Both plans include full gap coverage. If you fall in the coverage gap, aka donut hole, you will continue to have coverage and these same copays will apply. If you enter the catastrophic phase, you will pay CMS standard rates. We value your total health, physical, emotional, social. We want to help you reach your full potential in life, however you define it. So we want to support you wherever you are on your health journey. For those who want to focus on wellness, we have programs such as Resources for Living, Healthy Home Visits, and Silver Sneakers. For those who want to prevent health challenges from getting worse, we have programs to help chronic or complex conditions such as diabetes or heart disease. We also offer on-demand assistance through programs such as telehealth, teledoc, or 24-hour nurse line. For those who have complex medical conditions, we offer nurse care management, help preventing you from being readmitted to the hospital, and compassionate care for advanced illnesses. These programs are intended to complement your current health care. They aren't meant to replace it. Both plans include routine eye and vision exams, as well as eyewear reimbursement. The basic plan covers eyewear up to $50 every 12 months, and the Premier plan covers up to $70 every 24 months. The Premier plan also includes a hearing aid reimbursement of $500 every 36 months. This healthy home visit is completely voluntary. If you choose to take part, a nurse will come to your home to review your health needs and do a home safety assessment. The visit doesn't replace care from your doctors, but we work with them to help meet your health needs. The nurse focuses on safety in your home, does a medication review, and asks about your medical and family history. We may recommend any of our support programs that may be helpful to you. We'll talk about some examples of these programs next. We communicate the results of your visit with your primary care doctor. This program is available at no cost to you and will help you take advantage of the benefits available to you. 200 on-demand videos and live virtual classes. You will receive a packet in January with more information on how to use this program. We don't want you to worry about how you'll get to and from your medical appointments. That's why Aetna's Premier ESA PPO plan offers optional non-emergency transportation that gets you there and back. The plan includes 24 one-way trips per year. These rides are included in the Premier ESA PPO plan at no extra cost. The Meal Home Delivery Program provides 14 delicious and highly nutritious meals delivered to your home following your hospital stay. It will cater to special dietary needs, including diabetic and pureed foods. With the Premier ESA PPO plan, this benefit is provided to you at no additional cost. We want your transition to the new Aetna plan to be as smooth as possible. As part of the transition, we will cover a temporary supply of your drug during the first 90 days of your membership to the plan if you are new. Please contact us for more details. We understand that changing plans when you're in the middle of a healthcare treatment or facing surgery might be worrisome. So Aetna is here to help. As a new Aetna member, you will also have access to the Continuity of Care Advocate, who will support you through this transition. We know the healthcare system can be complicated. Speaking with someone who really knows about healthcare issues can put your mind at ease. If you are currently receiving care for a chronic condition, for example, heart disease, oncology, lung disease, or facing an upcoming surgery, we want to know. Before January 1st, 2021, you can call Aetna directly at 1-800-307-4830, Monday through Friday, 7 a.m. to 8 p.m. Central Standard Time, to inform us of your healthcare needs and start the continuity of care process. Aetna is here to help. We have a team ready to answer your questions, whether you need help comparing options, finding a doctor, or wanting to know what your copay will be for a certain prescription. Don't hesitate to call us. We are available Monday through Friday, 7 a.m. to 8 p.m. Central Standard Time. The phone number is 1-800-307-4830. We are excited for you to start enjoying your new plan. Thank you for your time today. Next, we will go over the benefits of the KelseyCare Advantage Plan. KelseyCare Advantage is a local Medicare Advantage plan that has been contracted and offered to Medicare-eligible retirees of the City of Houston since 2010. KelseyCare Advantage has been rated 5 out of 5 stars by Medicare for the past 5 consecutive years. This plan combines all of your Medicare medical and prescription drug coverage into one plan. This plan is 100% local to the Houston area, including provider network and member services. It allows you open access to all Kelsey-Seybold clinic location and providers, and no referrals are needed. This plan includes additional benefits that are not covered by traditional Medicare. For example, virtual health with a Kelsey provider who has access to your personal medical record and prescription medications you are taking. Here are some of the KelseyCare Advantage plan highlights. There are no deductibles for medical services or prescription drugs. Copays are low. Prescription drug coverage is included at no extra cost. The plan includes extra benefits not covered by Medicare. The $3,400 out-of-pocket maximum allows you to plan ahead. This is the worst case scenario. $3,400 is the most you'll pay out of your own pocket for medical expenses in the year. Anything after that is $0. The KelseyCare Advantage Plan premium is $42 a month per person. Some typical copays are $0 for a PCP office visit, $25 for a specialist. The inpatient hospital copay is $300. An out-of-patient hospital copay ranges from $150 to $175. The urgent care copay is $25. Video visits are covered with a $0 copay for PCP and $15 copay for specialists. The copay for an individual mental health session is $20 and $15 for a mental health video visit. You'll pay $10 for Tier 1 prescriptions and $15 for Tier 2 prescriptions. KelseyCare Advantage not only covers everything that is covered by traditional Medicare, but it covers extra benefits. KelseyCare Advantage not only covers everything that is covered by traditional Medicare, but also covers extra benefits like free gym membership through Silver Sneakers. You can go to any participating Silver Sneakers gym at no cost. Vision coverage through VSP. Retirees get an annual $50 eyewear allowance. Members get up to 20 free one-way non-emergency transportation to and from your medical appointments. Access to worldwide emergency coverage and urgent care in the U.S. In addition, you'll have access to virtual health and My Kelsey Online, which provides you with care anywhere in the world. Communicating with your health provider is easy through My Kelsey Online and the My Chart app for your smartphone. You can email your doctor, schedule appointments, view test results, review immunization records, and more. KelseyCare has been providing Houstonians with care for 70 years. We have 25 locations, 450 providers, and over 5,000 affiliate providers, and over 70 medical specialties. 6 new locations are opening in 2021, with more locations in the future. KelseyCare offers same-day appointments and is your one-stop shop with everything under one roof: doctors, pharmacies, and lab. Stars matter. KelseyCare Advantage is the only plan in Texas to be awarded 5 stars for 5 consecutive years in a row. This award is based on customer experience, managing long-term chronic conditions, keeping members healthy, screenings, tests, and vaccines, and handling issues and complaints. For more information about KelseyCare Advantage, call us at 713-442-2264 or visit us online at kelseycareadvantage.com/COH. Thank you for watching the City of Houston Medicare Advantage Plan Open Enrollment presentation. For links to the Medicare Advantage Plan Open Enrollment Decision Guide, enrollment form, plan summaries, and more, visit cityofhoustonbenefits.org. And if you have any questions about any of the plans, you can contact their Eligibility and Enrollment Support Centers. For questions about Aetna healthcare plans, call 1-800-307-4830, Monday through Friday between 7 a.m. and 8 p.m. Central Standard Time. For questions about the KelseyCare Advantage HMO plan, call 713-442-2COH, 7 days a week between 8 a.m. and 8 p.m. Central Standard Time. And for any general enrollment questions, contact the City of Houston Benefits Division at 832-393-6000, Monday through Friday between 8 a.m. and 5 p.m. Central Standard Time.